Please welcome the Deputy Secretary of Health and Human Services, Andrea Palm.
Thank you, and good evening, everybody. It gives me great pleasure to be here tonight to recognize Anita, Amanda, David, and the Vaccine Task Force for their outstanding and life-saving accomplishments. These exceptional individuals faced the daunting task of distributing hundreds of millions of vaccines to 80,000 different sites around the country, guide the public through an unprecedented public health campaign, and they needed to ensure that providers knew how to store and administer the vaccine. They brought pharmacies into the fold, as you heard, which played a huge role in distributing the vaccine in an equitable fashion. They helped Americans know when and where to get the vaccine, and they tackled vaccine hesitancy. And their use of data to solve logistical challenges ensured vaccines got where they needed to be, when they needed to be there. The American people have been the great beneficiaries of their novel ideas, their effective communications, and the long and tested experience of these three stellar professionals. This team and the thousands of public servants who worked on the distribution efforts that have gotten millions of shots in arms deserve our eternal thanks. So please join me in honoring Anita Patel, Amanda Cohen, and David Fitter from the United States Centers for Disease Control and Prevention, the 2022 COVID-19 Response Medal winners.
Wow. So good evening, and first and foremost, thank you so much to the Partnerships for Public Service for recognizing this incredible body of work. David, Amanda, and I are so incredibly privileged to be here, but we are just three of many in this entire vaccine enterprise that brought everything to bear. All of our federal partners, everyone from our other colleagues and folks in this category, including Suma, who's here from HRSA, Bob, who was part of the FEMA team, as well as our CMS, FDA, ASPR colleagues that really made all of this happen. All of our state and local, hundreds and thousands of civil servants that are there day in and day out and have been for the last 2.5 years through this pandemic. They were responsible for so much, and it was such an honor to be able to work with them and help them think through how to make vaccines available and how to make sure that we dealt with health equity in the best way possible, given the way that COVID has disproportionately impacted the population. When we think about our private sector partners, I mentioned a whole bunch of them in the videos, everything that was brought to bear in this very, very large response, the largest public-private partnerships that we've ever had on a scale that was just unbelievably unimaginable. Our manufacturer partners, our distributor partners, the partners that showed up to help us with our entire data infrastructure that helped us able to see what it was happening, both from a supply standpoint and then most importantly to understand who it was that was getting vaccinated and who we needed to do better outreach to. We also had a tremendous number of provider partners all across the country that stood up and showed up every single day during the highest time of death counts during this pandemic to ensure that shots got into arms. That dedication, that resilience, it lasted not for a month, it lasted for almost 2.5 years. And of course, the people, they showed up. To date, collectively, we've been able to get over 800 million doses of vaccines out the door and over 600 million vaccines into arms. There was a stat that came out earlier this year that said that 1.9 million people had were saved, that deaths averted because these vaccines were made available. And it's the collective work of the entire country that made that happen. And by the way, that number continues to go upwards. I have to pause and be able to say thank you to the incredible thousands of people at CDC that touched this work. That was the most humbling and the most incredible privilege that the three of us had, was to be able to help lead and guide all of these incredible public health practitioners to help solve these incredible problems. All of this work had to be deliberately done, and we planned and planned and planned before day one, before vaccines were ever made available. To that end, DoD was a huge component of this vaccine response, especially on the front end. General Perna and his team set the stage, expected more, kept us focused, really reminded us that we needed to be able to make decisions, that we had to have guts, and we had to have the ability to problem solve. Because of all this work, we were able to really lean in and start with our public health partners at the edge and make sure that we were able to support them. Every response is local, and this response was no different. They were responsible for ensuring the early vaccines got into the arms that it needed to. In addition, if you did in the last year get your vaccine, it was likely a 70% chance that it was in the pharmacy. Not only did these partners that were making up of almost 48,000 points, they showed up, but they also taught us a lot about health equity, how to reach into communities and to really bring people into trusted environments to be able to get the care that they needed. Care as basic as an immunization. So, with vaccines being the #1 way that we can help protect people in America against vaccine-preventable diseases, this foundation has been absolutely incredible. What we'd love to see is this foundation be able to be used for routine vaccination programs and also for outbreak responses. Since 2019, we've seen measles outbreaks, we've seen polio outbreaks, and of course monkeypox, all which challenge the basic healthcare infrastructure in the United States. If we can use any of our lessons learned from this response collectively as a US government, but also with public-private partnerships to really lean in, we've got private sector right now that's actually helping with public health and wants to be there. How do we improve healthcare, basic services like immunizations to be more available all across America? And lastly, I'd be remiss if I didn't thank the families that took care of us so we could take care of the nation. I have to say thank you to my husband, who's been an incredible force, and my 3 kids, Amanda's family, David's world. We can't do our jobs without that level of support and the commitment that they showed us and let us go so that we could help serve. So it's with unbelievable honor and with the gratefulness of being able to be part of something so incredible. On behalf of myself and David, thank you to everyone who touched this response and helped make vaccines available in the US. Thank you. I do want to make one special point because it was highlighting the work of Dr. Cohn. And for the record, she was my old boss for quite some time. So one of the most amazing things in this response was CDC's ability to be agile when it came to clinical guidance. It wasn't just for the first dose, the second dose, it was a booster dose, it was a second booster dose, and of course the updated booster campaign across all age groups. The volume and the agility in our ability to make scientific-based decisions to ensure that vaccines were getting out the door to the populations that needed it with the best possible guidance. At times, of course, it was complex, but really want to call out the work of CDC led by Dr. Cohn in really pushing this practice forward. And please, everybody, go get boosted again.